Imagine waking up one morning and hearing that a disease most Americans believed was gone forever is spreading again. Not overseas, not decades ago, right here, right now, in the United States. Measles, a virus officially declared eliminated in the US in the year 2000, is making a dangerous comeback, and the numbers are climbing faster than many people realize. In recent months, measles cases have surged across several states, with South Carolina reporting one of the largest outbreaks the country has seen in decades. Hundreds of confirmed cases, mostly among unvaccinated individuals, have reignited a public health emergency that experts warned could happen if vaccination rates continue to fall. This is not a hypothetical threat anymore. It is happening. To understand why this matters, you need to understand how serious measles really is. Many people still think of measles as a harmless childhood illness, just a rash and a fever that kids eventually outgrow. That belief is dangerously outdated. Measles is one of the most contagious viruses known to humans. If one infected person enters a room, up to 90% of unprotected people who share that space can become infected. The virus can linger in the air for up to 2 hours after the infected person has left. It often starts like a mild cold, fever, cough, runny nose, red watery eyes. But within days, the fever can spike to over 104 degrees. A rash spreads across the body, and for many, especially young children, complications can be severe. Pneumonia, brain swelling, permanent hearing loss, in some cases death. Even in healthy individuals, measles can cause long-term immune system damage, leaving the body more vulnerable to other infections for months or even years afterward. So, how did we get here? For decades, measles was kept under control thanks to widespread use of the MMR vaccine, which protects against measles, mumps, and rubella. The vaccine is safe, effective, and has been studied extensively for over half a century. When vaccination rates stay high, measles struggles to spread. This protection is called herd immunity. It doesn't just protect the vaccinated, it protects infants too young to be vaccinated, people with weakened immune systems, and those who cannot receive vaccines for medical reasons. But herd immunity has a breaking point. When vaccination rates drop below a critical threshold, measles finds its opening. In many communities across the US, that threshold has already been crossed. Misinformation has played a major role. Over the years, false claims linking vaccines to autism and other health problems have spread rapidly online despite being repeatedly and conclusively disproven by scientific research. Social media has amplified fear faster than facts. As a result, some parents delayed or refused routine childhood vaccinations, believing they were protecting their children. Ironically, those choices may now be putting children at far greater risk. Another factor is complacency. Many parents today have never seen measles firsthand. They didn't grow up watching children hospitalized with severe complications or hearing stories of permanent disability caused by preventable diseases. When a threat disappears for long enough, it's easy to believe it was never dangerous to begin with. Public health experts have been sounding the alarm for years. Now the consequences are becoming visible. Hospitals in affected areas are seeing a rise in pediatric admissions. Schools and daycare centers are forced to close temporarily to contain outbreaks. Families are quarantined. Healthcare workers are stretched thin. And every new case increases the risk that the virus will spread further into communities with low vaccination coverage. There's also a broader national concern. If measles transmission continues unchecked for more than 12 consecutive months, the United States could lose its measles elimination status. That would be a historic reversal of one of the country's major public health achievements. This issue isn't just medical, it's deeply social. It sits at the intersection of personal freedom, public responsibility, trust in science, and the role of government in healthcare. Many Americans value individual choice, especially when it comes to family and medical decisions. But infectious diseases don't respect individual boundaries. One person's decision can directly impact the health of others. This is especially important when we talk about children. Infants under 1 year old are too young to receive the measles vaccine. Their protection depends entirely on the immunity of the people around them. The same is true for cancer patients undergoing chemotherapy, transplant recipients, and others with compromised immune systems. For them, measles is not a mild illness. It can be life-threatening. The current outbreak is forcing a difficult but necessary conversation. How do we balance personal choice with collective safety? How do we rebuild trust in public health institutions? And how do we combat misinformation in an age where false claims can travel faster than facts? Health officials emphasize that the solution is not complicated, but it requires cooperation. Vaccination remains the most effective tool we have. The MMR vaccine is about 97% effective at preventing measles after 2 doses. Serious side effects are extremely rare. The risk of complications from measles itself is far higher than the risk associated with vaccination. Doctors across the country are urging parents to speak directly with healthcare professionals, not social media influencers, when making decisions about vaccines. Pediatricians are trained to address concerns, explain risks and benefits clearly, and provide evidence-based guidance tailored to each child. At the same time, public health departments are working to contain outbreaks through contact tracing, temporary quarantines, and emergency vaccination clinics. These measures can slow the spread, but they are reactive. Prevention is always more effective than response. The resurgence of measles is also a warning sign. When one vaccine-preventable disease returns, others can follow. We've already seen increases in whooping cough and mumps in recent years. Measles may just be the beginning if vaccination rates continue to decline. This moment matters because it challenges the assumption that progress is permanent. Medical advances can be undone if society stops valuing them. Diseases we once conquered can return if we let our guard down. For parents watching this unfold, the message from medical experts is clear. Protecting your child also helps protect your community. Vaccination is not just a personal health decision. It is a public health action with real-world consequences. For policymakers, the outbreak highlights the need for clear communication, strong public health infrastructure, and science-based policy decisions. Confusion and mixed messages only create space for fear to grow. And for everyone else, this is a reminder that health is interconnected. What happens in one state, one school, or one neighborhood does not stay there. Viruses travel, information travels, choices travel. The return of measles is not inevitable, it is reversible. But reversing it requires awareness, responsibility, and trust in evidence over fear. This is not about panic, it is about paying attention. If history has taught us anything, it's that prevention works when we commit to it. The tools are already in our hands. The question now is whether we choose to use them before more lives are affected. In part 1, we talked about how measles returned, how dangerous it really is, and why falling vaccination rates opened the door. But there's another side of this story that doesn't get enough attention. What happens after the outbreak starts? And why measles doesn't just disappear once the rash fades. One of the most overlooked effects of measles is thing doctors call immune amnesia. After a measles infection, the virus can erase a person's immune memory. That means the body forgets how to fight off illnesses it already learned to defend against. For months, sometimes years, someone who recovered from measles can be more vulnerable to infections like pneumonia, ear infections, and even common viruses. This is especially dangerous for children, whose immune systems are still developing. In other words, measles doesn't just make you sick once. It can quietly weaken your defenses long after people assume you're fine. This is why pediatric hospitals take measles outbreaks so seriously. Doctors aren't just worried about treating the initial infection. They're worried about what comes next. Secondary infections, hospital readmissions, long-term complications that don't show up immediately. These are the hidden costs that never make headlines but place real strain on families and the healthcare system. There's also the emotional toll. Parents who thought measles was no big deal suddenly find themselves watching their child struggle to breathe or spike dangerously high fevers. Families are quarantined for weeks, parents miss work, children miss school, entire classrooms are disrupted because one case can shut everything down. And then there's the financial impact. Outbreaks cost millions of dollars in emergency response, hospital care, contact tracing, and public health staffing. That cost doesn't disappear. It's absorbed by hospitals, taxpayers, and families. Preventing measles through vaccination is far less expensive than controlling an outbreak after it starts. Another uncomfortable truth is that outbreaks don't affect everyone equally. Communities with limited access to health care, language barriers, or lower trust in medical institutions are often hit harder. When misinformation spreads in these communities, it spreads faster and does more damage. That's why public health experts stress the importance of local outreach, trusted messengers, and culturally informed communication, not fear-based messaging. Right now, health departments across the country are racing against time. Contact tracers are calling families, clinics are extending hours, doctors are urging people to check vaccination records they haven't looked at in years. Many adults don't realize they may not be fully protected, especially if they received only one dose of the measles vaccine as a child. In some cases, a simple booster can restore full protection. This moment has also sparked intense debate about policy. Should states tighten vaccine requirements for schools? Should exemptions be limited? Or does that risk further backlash and mistrust? There are no easy answers, but public health leaders agree on one thing: confusion and silence are the enemy. When people don't get clear, consistent information, fear fills the gap. It's important to say this clearly. Asking questions about vaccines does not make someone irresponsible. Wanting to protect your child is human. The problem arises when fear replaces evidence and rumors replace science. Measles doesn't care what your intentions are. It only cares whether your immune system is prepared. For adults watching this unfold, it's worth checking your own vaccination status. Many people assume they're protected when they're not completely sure. If you were born after 1957 and don't have proof of immunity, doctors recommend talking to a healthcare provider. This isn't about blame, it's about awareness. What we're seeing now is a stress test for public health in America, a reminder that prevention requires participation. Vaccines only work at a population level when enough people take part. When participation drops, protection cracks. And measles is one of the fastest viruses to exploit those cracks. The good news is that this story doesn't have to end in failure. Countries that respond quickly, communicate clearly, and restore vaccination coverage can stop outbreaks. We've done it before. The science hasn't changed. The tools still work. What has changed is how information spreads. That means the responsibility doesn't just fall on doctors and policymakers anymore. It falls on parents, caregivers, educators, and even content creators. Every shared post, every conversation, every decision matters more than we realize. Measles is not a relic of the past. It's a test of whether society remembers the lessons that once saved millions of lives. The outcome depends on what we choose to do next. Because the question isn't whether measles can be stopped. It's whether we act before it spreads even further.